Protected learning time is an opportunity for practitioners to take time out of clinical practice.
Practice is closed, CHOC, the out-of-hours provider, cover for us, and we dedicate the whole afternoon to training and development and education.
To allow the practitioners to look at their learning needs, address those learning needs, network, keep abreast of best practice.
We can take what we've learned back to practice, share it with colleagues, but most importantly, improve the care that we offer to patients.
All staff, not just clinicians, so we have programmes running for non-clinical staff, reception, dispensary admin, as well as nurses, healthcares, GPs, trainees, nurse practitioners, so the whole gamut of staff in primary care.
Refreshers, updates, looking at best practice, local pathways, how best to serve people, how best to manage access, how best to manage the demands of modern day general practice.
It improves our learning. If we use updated guidance, it'll improve the patient care as well.
The health service across North Cumbria is a huge community. Everybody's here to support the local population. We're all local people and we just want the best outcomes for our patients, for our families and for ourselves ultimately as well. So we do everything that we can to support the local community.
I think it's great in terms of people being able to pick up some clinical tips, some ideas, a bit of networking so they can take them back to the practice and use them to great effect with their patients.
This afternoon there's also the opportunity for a number of organisations and collaboratives to highlight some of their work.
We're here today specifically to talk to colleagues about the collaborative approach that we're taking in primary care across North Cumbria in terms of at-scale working, centralising and scoping any work that can basically be taken out of practices and centralised to enable the practices to really concentrate on patient care and delivering greater patient outcomes across North Cumbria.
We've had the great opportunity of having the training hub alongside primary care to meet with everyone and share some of the work we're doing at the training hub for how to look after the current workforce, be that retention, but also what do we do about recruitment, about bringing more people in.
We're talking to people about chronic pain and we've done some fantastic work over the last few months and years around our opioid and gabapentinoid prescribing. Our clinicians have done a brilliant job of working with patients, but then of course the question came next, what else can we do? How can we support people living with pain? So we've now moved on to produce our mind maps today, which we've brought along, and that showcases all of the work that our localities are doing that's available for clinicians and patients to discuss and to talk about.
It's been a fantastic opportunity to step out of surgery, meet up with colleagues for some peer support and most importantly learn from the specialists that we've had presenting. It's been fantastic.